everyone, this is your PowerPoint presentation that reviews the chapter 16 exercises, some of them. Excuse me, this is the audio to assist with that. Similar to the chapter 15 presentation, this presentation will focus on the even number exercises because the answers to the odd number exercises are provided to you in the textbook in Appendix B. So for the procedure coding statement, for example, 1, 3, 5, 7, and 9 are provided to you back in your textbook in the Appendix B. If you have any questions on those particular exercises, please let me know via inbox communication or to the discussion board in this area. And once you have looked at this presentation or listened to it, and this presentation is going to focus on 2, 4, 6, 8, and 10, you are asked to post your response to the discussion board in the course, the specific discussion board. You can do that via text, or you can do an audio presentation or a video presentation. The last two, of course, using the Canvas tool. So if we look at number 2 in your textbook, chapter 16, under the procedure statement coding component, it states the patient's having an open excision of a nasal bone. You have the 4 pathway or the 4 common coding process questions. What is the root operation? What is the indexing path in your ICD-10 PCS coding manual, specifically talking about in the alpha index? What is the surgical approach for the clinical statement? And then what is your final ICD-10 PCS code? And these are the questions you would be answering on the class discussion board for this particular lesson related to chapter 16. For number 4, clinical statement states the patient is having a percutaneous placement of an intramedullary nail into a non-displaced fracture of the right femoral shaft. Again, as you are reading that clinical statement, what is the root operation? Based on your knowledge of ICD-10 PCS, based on the information you learned from the chapter 16, what would you state is the root operation? And then using that as a jumping off point for your indexing, you're going to index by the root operation. What is the indexing pathway? So what is your main term? And then what is your subterm? What is the surgical approach? And what is the final ICD-10 PCS code? For number 6, the patient is having a posterior lumbar interbody fusion, L4, L5, posterior lateral fusion of posterior spine with an allograft. Again, 4 questions. What is the root operation? What is the indexing pathway? What is the surgical approach? And the final code. Number 8, the patient is having a closed reduction of a fractured left mandible. Again, based on that information, what is the root operation? What is the indexing pathway in the ICD-10 PCS coding manual alpha index? What is the surgical approach? And what would be the final ICD-10 PCS code assigned based on that clinical information? And finally, the last one for the procedure statement coding is number 10. The patient is having an open replacement of the metal femoral head of a left hip prosthesis. The remainder of the prosthesis was not replaced. Again, what is your root operation? What is the indexing path? What is the surgical approach? And what is your final ICD-10 PCS code assigned? One hint I want to give you, of course, is to make sure you have read the chapters, and as you are going through this exercise, you may want to go back and look at the information in the chapter. And also, you should have gone through what is noted by your textbook authors as the code building exercises, especially before you move into anything that's graded for this class, because often some of the graded exercises will have very similarities with some of the non-graded. So again, while you're coding these, remember you are not restricted to only use your coding manual. So while you're coding these non-graded exercises, you can use all parts of the chapter. So go back to chapter 16, because a lot of coding is practice, as I've stated. but it also is applying the information, applying the guidelines, applying the anatomical knowledge, applying what I call coding practice, which are things that are done by coders but aren't necessarily in the guidelines. And she talks about some of those, and she calls them coding tips in your chapter. So as you're coding these non-graded exercises and the graded exercises, the graded assignments, you use all parts of your textbook, including the chapter information. Then if we move to the case studies, which are operative reports at the end of chapter 16, again, the odd numbers are given, the answers are given to you, the codes are given to you in the textbook appendix. So 1, 3, 5, and 7 are given to you. One is a right femoral neck fracture with a hemiarthroplasty. If you have any questions on 1, 3, 5, and 7, please let me know via one of those two methods, either Cam's inbox or the course discussion area. For this particular chapter, 16, number 4 and number 8 are part of your graded assignment in this course. The number 4 is a patient who has a distal radius and ulnar fracture. And number 8, the patient is having an incision and drainage of an infected right tibial plateau wound. So those particular exercises, again, I would remind you to use your chapter. Make sure you have coded the code building exercises or other exercises in the chapter so you have begun to build your skill. And also make sure you're paying attention to the assignment document that's provided for you in the course so that you are looking at the information I'm providing to help you move through those particular exercises. So for this presentation, we're going to focus on number 2 and number 6 from chapter 16. And in this case, for both of these, you are going to take on the role of an auditor. Again, you are given the information, you're given the clinical information, and you are also given codes. In this case, number 2, at chapter 16, the patient has a arthroscopic subacromial resection, an open bicep tendinolysis of the right shoulder. You're given 2 ICD-10 PCS codes. You're given 0PT90ZZ and 0LS44ZZ. Are these codes correct? Why or why not? And if not, what codes would you assign? Also, are these the only 2 codes assigned? Yes or no? If no, what additional code would you assign and why? And what clinical information would prompt you or could you use to validate the fact that you are going to assign an additional code? So again, you're taking on the role of an auditor, and you're going to answer these questions on the course discussion board. For number 6, the patient is having a fasciotomy with a common extendor origin release. This is working on the patient's elbow. The codes assigned by the coder that you're auditing were 0LN50ZZ and 0PBF0ZZ. Are these codes correct? Why or why not? And if not, what codes would you assign? So again, you're going to post your thoughts to these questions on the course discussion board, and I hope you do so. And at some point before the quiz is due for this particular lesson, the answers will be posted, but I want to give an opportunity for students to have a discussion, post your thoughts, and have some interaction. But the answers will be posted so that you do get the correct information and the correct codes. Thanks.